Welcome to The Explainer, your go-to destination for informative quizzes and engaging content. Get ready to put your knowledge to the test and learn all about strokes in our ultimate quiz. Stroke Quiz. Test your brain health. Are you up for the challenge? Let's dive right in. Question 1. What is the most common type of stroke? Is it A. Ischemic stroke, B. Hemorrhagic stroke, C. Transient ischemic attack, TIA, D. Cryptogenic stroke? The correct answer is A. Ischemic stroke. Ischemic stroke occurs when a blood vessel supplying blood to the brain is obstructed, leading to reduced blood flow and oxygen delivery to brain tissue. Question 2. Which of the following is not a risk factor for stroke? A. High blood pressure, B. Obesity, C. Regular exercise, D. Smoking. The answer is C. Regular exercise. While regular exercise is associated with a reduced risk of stroke, high blood pressure, obesity, and smoking are significant risk factors that can increase the likelihood of experiencing a stroke. Question 3. What is the term for a stroke caused by a rupture of a weakened blood vessel in the brain? Is it A. Ischemic stroke, B. Hemorrhagic stroke, C. Embolic stroke, D. Lacunar stroke? The correct answer is B. Hemorrhagic stroke. Hemorrhagic stroke occurs when a weakened blood vessel in the brain ruptures, leading to bleeding into the surrounding brain tissue. Question 4. Which of the following is a common symptom of stroke? A. Joint pain, B. Sudden numbness or weakness of the face, arm, or leg, C. Ringing in the ears, D. Blurred vision. The answer is B. Sudden numbness or weakness of the face, arm, or leg. Sudden numbness or weakness, especially on one side of the body, is a hallmark symptom of stroke, indicating a disruption of blood flow to the brain. Question 5. What is the acronym commonly used to identify stroke warning signs? A. Fast, B. Slow, C. Quick, D. Rapid. The answer is A. FAST. FAST stands for face drooping, arm weakness, speech difficulty, and time to call emergency services. It is an acronym used to recognize and respond to stroke symptoms quickly. Question 6. Which type of stroke is often referred to as a mini-stroke? A. Ischemic stroke, B. Hemorrhagic stroke, C. Transient ischemic attack, TIA, D. Lacunar stroke? The answer is C. Transient ischemic attack, TIA. TIA, often called a mini-stroke, is a temporary disruption of blood flow to the brain, typically lasting for a few minutes to a few hours. It is considered a warning sign of potential future stroke. Question 7. What is the term for the sudden loss of vision in one or both eyes, often occurring as a symptom of stroke? Is it A. Hemianopia, B. Diplopia, C. Scotoma, D. Hemianopsia? The correct answer is A. Hemianopia. Hemianopia refers to the sudden loss of vision in one half of the visual field in one or both eyes. It can occur as a result of stroke affecting the visual pathways in the brain. Question 8. Which part of the brain is commonly affected in a stroke that results in language difficulties? A. Frontal lobe, B. Temporal lobe, C. Parietal lobe, D. Occipital lobe? The answer is C. Parietal lobe. The parietal lobe is involved in language processing and comprehension. A stroke affecting this area of the brain can result in language difficulties such as aphasia. Question 9. What is the term for the condition where blood clots form in the heart and travel to the brain, causing a stroke? A. Embolic stroke, B. Lacunar stroke, C. Thrombotic stroke, D. Ischemic stroke? The answer is A. Embolic stroke. Embolic stroke occurs when a blood clot or other debris forms in another part of the body, typically the heart, and travels to the brain, causing a blockage in a blood vessel. Question 10. What is the primary treatment for ischemic stroke if administered within a specific time window? A. Anticoagulant therapy. B. Antiplatelet therapy. C. Intravenous thrombolysis. D. Surgical intervention. The answer is C. Intravenous thrombolysis. Intravenous thrombolysis, commonly known as tissue plasminogen activator, TPA, is the primary treatment for ischemic stroke if administered within a specific time window after symptom onset. It works by dissolving blood clots and restoring blood flow to the affected area of the brain. Question 11. What is the term for the type of stroke caused by a blockage in a small blood vessel in the brain? Is it A. Hemorrhagic stroke, B. Ischemic stroke, C. Thrombotic stroke, D. Embolic stroke? The correct answer is B. Ischemic stroke. Ischemic stroke occurs when a blood clot or other obstruction blocks a blood vessel in the brain, leading to reduced blood flow and oxygen delivery to brain tissue. Hey there, quiz enthusiasts. How's everyone doing so far? We hope you're enjoying the stroke quiz and learning some fascinating facts along the way. Before we continue with the quiz, let's take a quick breather and review some of the key insights we've uncovered together. From understanding different types of strokes to recognizing warning signs and treatment options, there's so much to discover in the world of brain health. So grab a snack, stretch those legs, and get ready for more mind-blowing revelations coming your way in just a moment. Question 12. Which of the following imaging techniques is commonly used to diagnose stroke and evaluate blood flow in the brain? A. X-ray. B. Magnetic resonance imaging, MRI. C. Electroencephalogram, EEG. D. Positron emission tomography, PET. The answer is B. Magnetic resonance imaging, MRI. MRI is a non-invasive imaging technique that uses magnetic fields and radio waves to produce detailed images of the brain, allowing healthcare providers to diagnose stroke and assess blood flow. Question 13. What is the term for the condition where blood vessels in the brain become weak and balloon-like, increasing the risk of hemorrhagic stroke? A. Aneurysm. B. Arteriosclerosis. C. Thrombosis. D. Embolism. The answer is A. Aneurysm. An aneurysm is a localized, abnormal dilation of a blood vessel in the brain, making it susceptible to rupture and causing hemorrhagic stroke. Question 14. Which of the following is a common long-term complication of stroke? A. Chronic obstructive pulmonary disease, COPD. B. Type 2 diabetes. C. Post-stroke depression. D. Osteoarthritis. The correct answer is C. Post-stroke depression. Post-stroke depression is a common psychological complication following stroke, affecting approximately 1/3 of stroke survivors. It can significantly impact quality of life and rehabilitation outcomes. Question 15. What is the term for the condition where a clot forms in a blood vessel in the brain, leading to a gradual onset of stroke symptoms? Is it A. Ischemic stroke, B. Hemorrhagic stroke, C. Transient ischemic attack, TIA, D. Lacunar stroke? The answer is A. Ischemic stroke. Ischemic stroke occurs when a blood clot or other obstruction blocks a blood vessel in the brain, resulting in reduced blood flow and oxygen delivery to brain tissue. Question 16. Which of the following is a common complication of hemorrhagic stroke? A. Paralysis on one side of the body. B. Difficulty speaking or understanding speech. C. Seizures. D. Numbness or weakness in the face, arm, or leg. The answer is C, seizures. Seizures can occur as a complication of hemorrhagic stroke, particularly if the bleeding irritates or damages brain tissue, leading to abnormal electrical activity. Question 17. What is the term for the condition where blood flow to the brain is temporarily disrupted, resulting in stroke-like symptoms that resolve within 24 hours? A. Ischemic stroke. B. Hemorrhagic stroke. C. Transient ischemic attack, TIA. D. Lacunar stroke. The answer is C. Transient ischemic attack, TIA. TIA, often referred to as a mini-stroke, is a temporary disruption of blood flow to the brain, typically lasting for a few minutes to a few hours. Unlike stroke, TIA symptoms resolve within 24 hours without causing permanent damage. Question 18. What is the term for the narrowing or blockage of blood vessels in the brain, increasing the risk of ischemic stroke? A. Atherosclerosis. B. Arteriosclerosis. C. Thrombosis. D. Embolism. The answer is A. Atherosclerosis. Atherosclerosis is a condition characterized by the buildup of plaque, fatty deposits, inside the arteries, leading to narrowing or blockage of blood vessels. It is a major risk factor for ischemic stroke. Question 19. Which of the following is a common symptom of stroke affecting the cerebellum? A. Vision loss. B. Severe headache. C. Balance and coordination problems. D. Difficulty speaking or understanding speech. The answer is C. Balance and coordination problems. The cerebellum, located at the back of the brain, plays a crucial role in balance and coordination. Stroke affecting this area of the brain can result in symptoms such as dizziness, vertigo, and difficulty walking. Question 20. What is the term for the condition where blood flow to the brain is blocked by a blood clot formed within a blood vessel supplying the brain? A. Embolic stroke. B. Hemorrhagic stroke. C. Thrombotic stroke. D. Ischemic stroke. The answer is C. Thrombotic stroke. Thrombotic stroke occurs when a blood clot forms within a blood vessel supplying the brain, leading to a blockage and subsequent ischemia, lack of blood flow, to brain tissue. Question 21. Which of the following medications is commonly used to prevent blood clots and reduce the risk of stroke in individuals with atrial fibrillation? A. Aspirin. B. Warfarin. C. Insulin. D. Metoprolol. The answer is B. Warfarin. Warfarin is an oral anticoagulant medication commonly used to prevent blood clots and reduce the risk of stroke in individuals with atrial fibrillation, a heart rhythm disorder associated with an increased risk of stroke. Question 22. What is the term for the condition where blood flow to the brain is disrupted by a blood clot that travels from another part of the body, such as the heart or neck arteries? A. Ischemic stroke. B. Hemorrhagic stroke. C. Transient ischemic attack, TIA. D. Embolic stroke. The answer is D. Embolic stroke. Embolic stroke occurs when a blood clot or other debris forms in another part of the body, such as the heart or neck arteries, and travels to the brain, causing a blockage in a blood vessel. Question 23. Which of the following lifestyle modifications can help reduce the risk of stroke? A. Consuming a high-sodium diet. B. Maintaining a sedentary lifestyle. C. Smoking tobacco products. D. Eating a balanced diet rich in fruits and vegetables. The answer is D. Eating a balanced diet rich in fruits and vegetables. Consuming a balanced diet rich in fruits, vegetables, whole grains, and lean proteins can help reduce the risk of stroke by promoting heart health, maintaining a healthy weight, and lowering blood pressure and cholesterol levels. And that wraps up today's stroke quiz, folks. We hope you had a blast putting your knowledge to the test and learning all about brain health. If you enjoyed the quiz and want to keep exploring the fascinating world of health and science, don't forget to hit that like button, share with your friends, and subscribe to The Explainer for more engaging quizzes and educational content. Until next time, keep on learning, keep on exploring, and stay curious with The Explainer.